Kia ora, I'm Gwen McClure, and today on The Detail, how New Zealand's outdated alcohol guidelines put us out of step with modern research.
The alcohol guidelines are interesting, aren't they? Because everyone wants to know whether or not the amount that they're drinking is going to be safe or not.
Whether alcohol lobbyists have a place in shaping our health policy.
It's very, very clear that you don't invite the wolf into the hen house.
And how those lobbyists played a role in putting a review of the guidelines on hold.
We, at the moment, are sticking with these, nearly 15-year-old guidelines, and the review of that has been paused.
RNZ's Guyon Espiner has broken several stories on our alcohol lobby and alcohol harm over the past few months. He says these guidelines are important for individuals, but also for the drug and alcohol workforce to know when someone might need a referral for help. So let's start with what those guidelines actually say.
So our guidelines say that men should have a maximum of 15 standard drinks a week, and that includes 2 alcohol-free days a week. So no more than 3 a day over 5 days and 2 days off the booze completely. And for women, it maxes out at 10, so 2 standard drinks a day for 5 days. That's for a maximum to keep yourself in the low-risk drinking guidelines. But, Australia, the UK have been considerably less than us, and Canada too, although there's some debate about what's official and what's not official in the Canadian sphere. But they certainly had a substance and health advisory group that said it should be no more than 2 standard drinks a week in Canada. So
for men and for women.
For men and for women, yeah.
That's a huge difference.
It is, isn't it? And, there's changes here in the US too. They've been, the Surgeon General made some warnings about that. So, yeah, look, this is a field where, as consumers of information will see, that there's a lot of evidence coming out and a lot of warnings coming out that even drinking at what we would have used to consider moderate or low levels can increase the risk that you may have health impacts from your drinking. New Zealand's guidelines were written in 2011. We obtained information from Health New Zealand which said, look, these guidelines are out of date. In that time, a lot more scientific evidence has emerged about the health risks of alcohol. We know it's linked to 7 different types of cancer. It's hard to open a website now without seeing articles saying that really even drinking at mid to lower levels of alcohol can carry some health risk, and that can be elevated when people are drinking more. So in short, Health New Zealand is saying, look, these guidelines are out of date. They were written in 2011. There's a lot more evidence that's emerged since then, and other countries have reduced them significantly below New Zealand. We need them updated and we need them reviewed. That's what Health New Zealand is saying.
But Te Whatu Ora Health NZ and the Ministry of Health are not on the same page. We'll come back to the new research soon, but first, the review of these guidelines. They were started by the former Health Promotion Agency and continued by Health NZ after the 2022 health reforms.
The complication is that the Ministry of Health has come in over the top of that and said, actually, these are our guidelines. We kind of own them. We want to control this, and we're putting a pause on that work. What we got was emails released under the Official Information Act, which showed that a lobbyist with the Brewers Association had emailed Ross Bell, who's with the Ministry of Health, and said, hey, look, what's this about a review of the drinking guidelines on a Health New Zealand website? He didn't like the fact that it linked also to the Canadian guidelines, and it had a link to significant reductions in Canada's advice. And then he emailed again complaining that the material was still up there. And Ross Bell went to Health New Zealand and basically said, what's this doing there? He looked into it and he got it taken down and he got that review put on hold. He's saying, look, this wasn't because the alcohol industry asked me to. This was because it was pointed out to me by the alcohol industry, but I wanted to clear up confusion about whether the Ministry of Health or Health New Zealand should own these guidelines, and then he put it on pause, saying that they had potentially had greater priorities.
We asked the Ministry of Health what was going on. They told us that they understand Health NZ is still doing some work on the review, and both organizations are working together on potential next steps. It sounds like the issue of who does what in health is still being sorted out in the wake of the reforms. Alcohol harm reduction is one of those projects where they're still figuring out whose umbrella it falls under. A statement attributed to the ministry's Dr. Andrew Old said that Phase 1 of the review of the low-risk drinking guidelines has been completed, and the ministry is still considering where Phase 2 fits as it prioritizes next year's work program. Also, it says reference to the drinking guidelines review was removed from the alcohol.org.nz website to avoid confusion about roles and responsibilities. But Guyon says it's clear the alcohol lobby has the ministry's ear.
It certainly does show that they're listening to the alcohol industry, who are pretty exercised about this, because, as you can imagine, this could have a significant effect on sales if people did take this advice and did drink significantly less.
Well, and this wasn't the only instance that you saw of the Ministry of Health meeting with alcohol lobbyists, right?
The material I've got shows that, yes, they've had a lot of meetings, a lot of email contact. In fact, one looked like a regular meeting between alcohol lobbyists and Ministry of Health staff. They've also shared with the alcohol industry their plans on how they will combat fetal alcohol spectrum disorder, which is, the result of women drinking during pregnancy. So they shared that entire draft document with them, and also shared with them plans about how they might spend the alcohol levy. The alcohol levy is a tiny fraction, a cent or two, that you'd pay on a bottle of wine. They put that on their price, and then it's what's called a hypothecated tax. It's a $16 million fund that is raised through that, and it's ring-fenced, so you can't spend it on anything other than reducing alcohol harm. And the industry have been allowed to have a say in how that money is spent. Now, there's an argument, the wider argument is, should industry have that role in shaping public health policy? It's interesting, but I don't have a view on that. But I'm happy to tease out the elements of the debate. We don't afford tobacco executives that luxury or that right. Specifically, we're signatory to the Framework Convention on Tobacco Control, a World Health Organization initiative, and there's a clause in there that New Zealand has signed up to that says that you won't allow the vested interests of the tobacco industry to shape policy. And so they're locked out of the policy-making process. You won't see Philip Morris or Imperial or British American Tobacco having a say on tobacco control policy. And it goes further than that and says that any engagement between health officials and the tobacco industry must be recorded. And you can see, if you get bored, you can go to the website hosted by the Ministry of Health and have a look and see which companies have rung or emailed at various times wanting input into various things, or saying, about labelling or whatever it might be. So there are very strict rules around tobacco. What's interesting is that the alcohol industry has escaped most of that scrutiny. So you don't see cancer warning labels on alcohol, even though the science says it's linked to 7 different types of cancer now. You don't see them being locked out of the policy-making process as the tobacco industry has. Now, some people will say, look, they're completely different substances and that alcohol has a greater cultural resonance and therefore should be afforded a greater degree of acceptability. Now, again, I don't have a view on that. I just find it interesting that you've got this substance which obviously causes harm in many degrees, and the science is saying that there's new information about that, and yet we treat it quite differently from tobacco. So I'm finding that quite an interesting thing, and quite some interesting rocks to roll over and see what's beneath them,
There's a bit of a history of the alcohol industry having a real input in our laws, right? Can you tell me about some of that?
Yeah, there certainly is, and they've done a good job for their, their companies and their shareholders, and you'd expect them to do that. That's what lobby groups do. They say, how can we have the most favourable regulation for our product? But if you look at something like the pregnancy warning labels, that was a 20-year battle. The alcohol industry fought that for 20 years, and it was only in 2023 that it became mandatory to have those little crosses through with the pregnant belly on. You'll see that on alcohol products now, and it became mandatory in 2023, but that was a 20-year fight from alcohol harm reduction advocates to get that on, and the industry fought it pretty hard and pretty successfully.
To add some context there, the US mandated those warning labels in 1988. Guyon's just written another article about how Ireland is now mandating cancer warning labels on alcohol starting next year.
It's quite comprehensive. It includes, for example, a warning that there's a link between alcohol and fatal cancers, a warning that alcohol causes liver disease, and a warning about drinking in pregnancy.
You can bet your bottom dollar there'll be a lot of interest from the alcohol lobby in New Zealand, and you can imagine that there will be a considerable pushback if a government was to go down that track in New Zealand.
The pushback has already started.
Here in New Zealand, the industry lobby group, the Alcoholic Beverages Council, doesn't want the cancer warning labels in New Zealand.
There's a lot more to it than that. I think if we actually have a look at the background to it, I mean, the level of risk of cancer associated with alcohol, it's very complex. It depends on the amount consumed, the drinking patterns, lifestyle choice, exercise, diet, genetic factors and more. There is a level of complexity, I think, and it's difficult to put on a label.
That's the Executive Director of New Zealand Alcohol Beverages Council, Virginia Nichols, talking to RNZ's Morning Report. She says the best place to get information on any health concerns is from your doctor. Andy Towers is an associate professor of mental health and addiction at Massey University, and he co-directs the mental health and addiction training program there. He's also working on that review and still has a contract to do so in spite of the dispute between the ministry and Health NZ. Andy says what researchers know about alcohol's risks has changed in the last 20 years. And looking back over old research, it became clear that it had been interpreted wrongly to conclude that moderate drinking was good for you.
A whole bunch of researchers around the world looked back on the studies and said, actually, there are some fundamental errors with the way they did this. It's really simplistic. And the first thing they did was said, you're comparing moderate drinkers to people who don't drink. And they're not all the same. There are a lot of people who were called, who used to drink, but don't drink anymore. And they're called sick quitters. They quit alcohol because they got ill. They got sick. This past research was comparing drinkers in good health to these people who were obviously not in good health. So there was a fundamental issue with who they're comparing it to. And then the second thing we did was we stepped back a bit and said, well, actually, what else changes between those drinking groups? And what we found was those people who are moderate drinkers, they don't differ just on drinking. They're actually rich, white, they have good houses, good homes, lifestyles that facilitate health. They can afford good food, medical care. What we realized then was it's not about how much you drink, it's about who is drinking. And we realized that alcohol use and health, they weren't causing each other, they were both related to wealth.
How bad is alcohol really for us then?
Alcohol is like any other drug. It is foreign to our system, and when you put alcohol in your body, it interferes with all of the health mechanisms, the health organs, and all the health systems. So it is quite damaging. Alcohol is a teratogen. So what happens when your body processes alcohol to stop you getting drunk, it processes it into another molecule, and that subsequent substance is carcinogenic. And then your body's trying to get a carcinogen out of the body, which is why alcohol is related to so many cancers, because everywhere throughout your body that alcohol touches, you raise the risk of cancer, but you also raise the risk of heart disease and cognitive impairment and liver disease and mental health and addiction issues. So it is a very, very powerful drug. It's one of our most powerful drugs, but because it's legal, we don't think of it as a drug. It's similar to any other drug. The more you have of it, the more your risk.
I feel like every time alcohol comes up, the conversation sort of goes, yep, I know it's not good for me, but there's lots of other things that we do that aren't good for us. You know, I mean, we spend time in the sun. We eat a lot of sugar. I mean, is there any legitimacy to that argument that everything we do might be a little bit bad for us? Is it just another thing in this basket?
Look, it absolutely is. And this is why a lot of people in public health, in fact, most people I know of, they talk about harm reduction. Prohibition doesn't work. We know that it doesn't work for anything, for alcohol, for other drugs, for sugar. It just makes the issues worse. What we need to say is, yes, these things are harmful, and we have a much better idea of how harmful they are. So therefore, it's up to you the degree to which you are happy to take on board that risk yourself. So that's why national low-risk drinking advice is important, because it's saying we're not prohibiting alcohol use, but it's actually a lot more harmful than we thought it was. And therefore, this is what we can say is anything is low risk, and anything beyond this is much, much more likelihood for you developing these sorts of health concerns and maybe death. It's not about taking away people's rights. You can do what you want. You can drown yourself with sugar if you want, but just know that you're increasing your risk for all these harmful health outcomes. Same with alcohol.
Do you feel comfortable knowing how much contact there is between the alcohol lobby and our policymakers?
It's really concerning to see over the past 5 to 10 years more and more reporting of the engagement of the alcohol lobby with politicians, with policymakers, and lately more concerning to see it go through to the area of ministries. It's very, very clear that you don't invite the wolf into the hen house. Unfortunately, alcohol industry makes money based on alcohol use and resulting alcohol harms. And in a space where we are trying to reduce the harmful use of alcohol and reduce those harms for society and for communities, there is no space for the alcohol industry there. They do not get to sit at the table, just as you wouldn't invite an arms manufacturer to the table to talk about cessation of violence, just as you wouldn't invite the tobacco industry to talk about how to reduce the use of cigarettes. It is inappropriate for the alcohol industry to have anything to do with alcohol-related harm policies.
Is there not an argument that, if we're not trying to promote the cessation of violence, but just limit the violence, and I'm saying that in terms of our earlier conversation about prohibition not working, so we're just talking about harm reduction, that the arms manufacturer knows better that, or the tobacco companies know better than anyone else how their products work, and maybe how to reduce the harm from their products.
Yeah. It seems natural to think that if we're going to solve issues like alcohol-related harms, that we should have everyone around the table. And it seems like a good step forward. But what we've seen time and time again, both in Aotearoa and internationally, is that the alcohol industry is in the same space as the tobacco industry was about 50 years ago. So they are using the same tactics, the same techniques. They are fighting the evidence. They are polluting research to say, no, there are no harms of alcohol, or those harms are overstated, and there are actually benefits of alcohol use. And we know that's not the case. So we know that they're not acting in good faith, but also when they have been around the table, or they are trying to be in this space, they are advocating for solutions that don't actually solve the major issue. So what they tend to do is promote ideas of personal responsibility around drinking. And again, that might sound a natural thing to talk about, but what we know is that if you have environments that are alcoholic, there's a hell of a lot of easy access to alcohol use. It's cheap, it's available, it's in our supermarkets. We know that alcohol use will go up and alcohol-related harms also go up. So the alcohol industry has shown time and time again, they are not interested in changing their behaviour. They want to change other people's behaviour. They want to continue with this, even though we know the research says very, very clearly what they're advocating for does not work. They keep advocating for that, saying it's not our problem, it's about the drinker. And we're saying, no, it's not. You are part of the problem as well. I'm paid not by the alcohol industry. I'm not paid by someone else to find that alcohol is bad. I'm paid by the government through the university to do evidence-based research. So whether I find that alcohol is good or alcohol is bad or alcohol is indifferent, I still get paid. I don't have a vested interest here. The alcohol industry does.
Can you give me some examples, too, of instances where their lobbying has had an impact on our policy?
Look, one of the problems with alcohol lobbying is that you can't identify person X speaking to politician Y and therefore legislation Z changes or policy Z. But what you can see is that when we are approaching things like the local alcohol policies, LAPs, so when that was introduced over a decade ago, the local alcohol policies were meant to provide communities with the ability to reduce alcohol-related harms.
After nearly 10 years of fighting for this, I'm so proud that Auckland now has a local alcohol policy. Our communities have told us enough. We have too many liquor stores in our neighbourhoods. As a result of this policy, there will be a 2-year freeze on new bottle stores opening up in 23 suburbs plus the city centre. And off-licences across our region must stop selling alcohol by 9 p.m.
Unfortunately, what we saw was that the required evidence to identify harms in communities, it was impossible to provide because for some reason, the legislators, the policymakers had decided that a certain threshold of evidence was required, and that was not in keeping with anything that any researcher that I know thought was sensible. And when we were talking to others in the space, they said, it's impossible. Local alcohol policies will not work. And also, alcohol industry was given effectively a free rein to, even when there was a strong alcohol policy, to kick back on it and take it to court. And that's why you saw time and time and time again, local alcohol policies were not making it through the system. They were not enacted because the evidence was too high, which is ridiculous. And alcohol industry, which has deep pockets, just took people to court. They took cities and towns to court. And ultimately, we can't win when it's a fight about money. And researchers, anyone paid by government, local government, national government, we don't have any money. And it's an uneven playing field. I mean, even the current reporting by RNZ that the alcohol industry is now raising concerns that the government is reviewing the low risk advice and that they weren't included in anything. And so now suddenly we're seeing people say, oh, no, we need to stop this process. I didn't ask to stop the process. I don't know of any public health person around the country or alcohol harms person around the country in this space who would want to stop a review of low risk alcohol use advice because, it's well past due. So it's very, very unclear who made the call to create this as a contentious space. It's not contentious.
How are we doing compared to other countries, both on our policy and on our outcomes?
Well, firstly, look, Aotearoa basically has a drinking problem. Our research shows really, really clearly that Kiwis, more Kiwis drink than in many other countries. And also when we drink, we tend to drink more frequently per week. And also we have more per session. And so we currently have quite a high level of alcohol use and therefore a high amount of alcohol harm in our communities, for our economy, for the health system. That kind of puts us above the average in the OECD. And a number of international researchers I've worked with said, wow, we didn't realize that New Zealanders drank so much. And unfortunately, because we're in a space where high levels of alcohol use are normal, it's very, very hard to get people in the community to realize this isn't normal. This isn't okay. Because they'll say, well, we've always drunk this way and it's fine. I haven't died yet. My family hasn't died yet. So we say, yeah, that's called survivorship bias. And also this level of alcohol use simply isn't normal if you step outside of Aotearoa. In terms of alcohol, I mean, we're not necessarily drastically different in terms of the types of outcomes that are seen in other countries. Other countries are grappling with the same issue and also the alcohol industry at the same time. Where I think we're behind is fundamentally we've seen other countries do the small things. And one of those small things is review our low-risk alcohol use advice. I mean, that's a small thing. It's one thing. But if we're not even doing the small things, then it says very, very clearly we don't have a system that cares about alcohol use.
That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Thank you to Guyon Espiner and Andy Towers. This episode was produced by Alexia Russell and engineered by William Saunders. I'm Gwen McClure. Mā te wā.